gosh. Hey there, Chris. My name is Bianca Nelson. I'm going to be taking care of you today.
Hi.
Can I ask you for 2 patient identifiers just to confirm I'm in the right room?
Christopher Lepak, 6/21/1959.
All right, that looks right on our computer, and on your wristband there, it looks perfect. How you doing today?
Good.
Anything special that brings you in?
Nope.
No?
Just routine.
Perfect. Well, I'm just going to take a look at your lungs and your thorax and kind of all those things today. Have you been having any issues at home with shortness of breath?
Nope.
Trouble breathing?
Nope.
Okay, have you had an abnormal exam in the past?
No.
Okay, so really quick, I'm just going to ask you to stand up. I'm just going to take a general look at your thorax and kind of inspect.
Mm-hmm.
It doesn't look like you have a barrel chest or pigeon chest. It looks like the ratio of your thorax is 1 to 2, which is what we expect. It doesn't look like your breathing is labored. It looks symmetrical. Your shoulders look even on both sides, which is perfect. Just looking at your spine without palpating it, it looks straight. I don't notice any scoliosis or anything like that, so that's good. You can sit back down. I'm just gonna count your respiratory rate, and I'm gonna feel your pulse while I do that, okay? Because that kind of just helps me to keep time. So just stay relaxed. All right, looks like about 16, so that's good. What we want is in between 12 and 20. Also, it didn't look labored. It doesn't look like you're using any accessory muscles. Your breathing was silent, and the depth was adequate.
Okay.
Alrighty. Did you ever have any troubles breathing at home? Okay. So I'm gonna move on to the part where I kind of start palpating some areas. I want you to let me know if you're having any pain or if anything's uncomfortable, and I can take a break or anything like that. Okay.
Okay.
First, I'm gonna touch right here to look at your trachea, right here in your suprasternal notch. It appears midline, no deviation there, which is what we want. Then I'm gonna assess the symmetry of your breathing just by touching here at the small of your, kind of in your back. Can you take a deep breath for me? And perfect. And that was symmetrical expansion with my hands. I'm gonna do that again in the front. Take a deep breath. Perfect. Symmetrical in the front as well. Alrighty, now I'm just gonna palpate and touch some spots on your back, looking for any abnormal masses or any tenderness. First, I'm just gonna touch your spine, just to kind of confirm that there's no curvature or anything. Looks good. And now I'm just gonna start up here and kind of feel some area. So let me know, all right? If you have any tenderness, I don't notice any masses or anything like that. Any pain?
No.
Awesome. I'm gonna move up front and kind of do the same. Starting up here, here, and then just working my way down your chest, okay? Alright, nothing up front? All good? Okay. Now I'm gonna start and I'm gonna test for, it's called tactile fremitus. It just is me looking at the vibrations kind of and making sure we're symmetrical across all your lung fields, all right?
All right.
Okay, so I'm gonna start in the back here. If you could just say 99 over and over again when I ask. Go ahead.
99, 99,
Perfect.
99, 99, 99, 99.
Perfect. Everything there was symmetrical on each side. As I worked my way down, the vibrations got less, but up top they were easier to feel, which is totally normal. I'm gonna do the same thing here. I'm just gonna feel your trachea first though.
99,
Awesome.
99, 99, 99, 99, 99, 99, 99, 99.
Same thing there. Up top at your trachea, I could feel the vibrations more, and as I worked my way down to the periphery, they decreased. And that is just what we would like. All right. Now I'll keep moving back and forth here, so just pardon me. Now I'm just gonna kind of percuss in some of those same feels, just looking for the resonance. What I'm wanting is kind of like a drum-like, low-pitched feeling. Pardon me as I work my way down. Alrighty, that looks normal. I'm gonna do the same over here, starting up top. So. It's kind of a little bit harder to feel down here, but everything is feeling and sounding okay. Alrighty, and then last but not least, I'm gonna take a listen. Alrighty, so when I ask if you could just take some deep breaths, okay? Alright, go ahead. Just breathe deep through your mouth. Awesome. Awesome. All of your breaths sounded clear. I didn't hear any wheezing, no crackles or fine crackles, no stridor or anything like that. Were you comfortable taking those deep breaths? Awesome. So you have your vesicular and then your bronchofascicular, which is closer to your scapula. All sounds very good. I'm going to take a listen up front, and I'm going to listen at your trachea first, okay? Take a deep breath. Nice and clear, and then I'm going to move on. I'm going to listen here on your lateral side, your right side, because you have 3 lobes on the right. Deep breath. Awesome. Everything sounded clear up front as well. Do you have any other questions for me? Anything else I can help you with today? Alrighty, well, it was nice meeting you. I hope to see you again.
All right.
Have a good day. Just gonna wash my hands on the way out.